All right, folks, come on in. Come on in. We're going live on Facebook and on YouTube.
Do you think they could come right through the screen?
That's right. Come on in and join us. Hi, folks. I'm Bob Schrupp, physical therapist.
Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, Mr. Heineck, we're going to talk about how science says these three postures can cause both sciatica and back pain.
Right.
And we know this from experience that this is the case.
Right. I mean, this just supports what we already feel is what's happening with our patients and everyone else.
So you're going to want to avoid these three postures, and we're going to try to get to them. But remember, by the way, if you are new to our channel, if you're watching us on the rebroadcast site, rebroadcast, it'll come out on YouTube. Make sure you subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, if you haven't yet, go over to Facebook. We're all live on Facebook right now, too. And like us, because Brad and I, as children, we're not liked, and we're trying to turn things around.
Bob, your speech is getting better.
All right, thanks a lot. All right, so Brad, this study was based well, Nachemson first did it.
Right.
Dr. Nachemson, right?
And that was back in the 60s and 70s. He did a number of studies on pressure in the disc related to postures. But then again, later, 1999, and even after that, they've done more studies. And the thing is they could do them much more accurately because the technology, and not only that, they've done them on live people.
On live people. They actually took needles and put it right into the disc of a person while they were alive.
Right, not just the needle, but the sensor in there. So they had a wire coming out of the back with the sensor in the disc, and this person was doing these techniques, measuring the pressure in the disc while this person's
so they could actually tell which postures are bad and putting a lot of stress on your back and which ones are not. So that's really what it comes down to, is it, Brad?
Right. So what is the worst one, Bob?
Let's start off with, well, it's not the worst one. This is one of the worst ones.
Right.
So normally do you want me to take this, Brad?
Go ahead, Bob.
If you're standing up straight like this, you have 100% of weight on your back.
Yeah, and we're talking about the lumbar spine because that takes most of the pressure in the back.
So one of the bad ones, this is number one now, is actually just bending forward like this, like you would be maybe when making a bed, or I see a lot of nurses doing this when they're working with patients.
Right. And you don't even have to bend forward that far. If you're slightly bent forward and you're in the kitchen working over a counter, you're going to put yourself in a similar posture.
So this is 100%, Brad. How much more weight does this put on your back?
More than double, 220%. It increases the pressure in the disc. So that means that's going to increase double the pressure on the disc. So herniation.
Just from doing this, leaning forward. So let's address this issue first. How do you avoid doing that, Brad? You know, one of the things that you want to do is, whenever possible, is support yourself. If you lean forward, because this takes immediately some of the stress off the back.
Right.
So if you can do some, like if you're making the bed, not the bread. If you're making the bread too, I guess. But if you're making the bed, you can actually support yourself with one hand, and go ahead and move the covers around with the other.
Right. And if you are doing some activity just over a countertop, whether it's at work or in the kitchen, just stand up straight.
Right.
Simply correct your posture, because a lot of people are completely unaware because they're so involved with their work, or they have not been taught how good posture is healthy.
Right.
It's time to crack down.
The other thing that I see with nurses, what they should do quite often, instead of leaning forward like this, is they should actually kneel down if they can, or get a chair or a stool and pull it up and sit by the person, as opposed to bending over and dealing with them.
You know, if you're working on a bed, whether it's at home or in the medical system,
put the one
knee up on the bed.
Very good, Brad.
Take some stress off your back. And of course, instead of rounding, you're going to straighten that back, is going to help as well. And then put one hand, if you can, support as well. All these little things are going to take stress off of that back.
By the way, Brad, I failed to mention this. After we get done with the presentation, which should be that long today.
Sure.
It shouldn't take us that long to go. Again, we're doing the three postures that can be harmful for you. We're already talking about number one. After that, we will take questions.
Sure.
So both on Facebook and on YouTube. So now also, if you are going forward like this, to kind of counteract that, as the antidote for that, you actually, after you do that, you want to do some press backs like this. So I'm taking my hands, I'm putting them right below my belt here, and I'm pressing back here.
Right. We call them lumbar extensions, or just back bends. press backs.
Yeah.
If you got a strap, or you could take a towel, sometimes putting that right around your back here, and then that offers support and actually feels better. You get a little bit better stretch.
That even works for the mid back too. I mean, when you get that up there and you work your mid back like this works really well. You see pregnant women doing this quite often, that they're just inherently seem to know that this is the right thing to do. But this really does help if you, especially do a lot of bending forward. Just go ahead and do some bend backs. You can also do it on a mat. You can do some press ups like this. You can go ahead and get down on the floor and go ahead and do some press ups like this, especially if you've done a lot of lifting, bending forward. So, should we go into the next posture, Brad?
Well, I wanted to cover one more thing I really want to stress, because I know there's a lot of parents out there that are watching, is with your children, is teach them to have good posture at an early age. It's a big difference. Then you don't have to readdress this, and it works.
Yeah, once these habits are taught, or learned, it's hard to it's hard to unlearn bad habits too. I mean, so if you all your life you've been taught, you learned to lift like this, it's really hard to start going like this.
Yeah, to lift properly. And just posture, it's amazing. You and I both had high school students, and they'll come in and they'll sit slouched, and you say straighten up with good posture, and they say, boy, that feels really funny.
Yeah, it looks funny. I look stupid, and they think they look better this way.
Right.
So, all right, next one, Brad. Should we talk about the next one? Was a seated posture, wasn't it?
Yes. So this was 220% increased pressure on your disc compared to standing. Now, if you sit slumped, which happens pretty much on a regular basis.
So everybody battles this.
If you're at a computer workstation, if you're at a desk.
So his back is rounded out. Right. He's got the forward head posture. Right. He's got the rounded shoulders.
Sure, like this, or like this, and you're rounded out.
If you're even leaning back in your couch and sinking into a soft couch, that also is putting you in that rounded out posture.
You bet. That increases it 170%.
So again, 100% with standing straight, just sitting down, which you think a lot of people think it's taking stress off their back, don't they? No, you're at 170% with a slouched back.
Right. So. See, that's why sitting is the new smoking, they say.
Right.
And this is a big part of it.
That's one of the reasons, is the posture issue. Now, what can you do, Brad, to avoid that seated bad posture?
Sit up straight.
Well, sit up straight, but you can also use some devices to help you, right? We've got a whole array of lumbar supports here. You probably can't see them on camera on the YouTube, but there's different sizes. You can start off with just using a rolled towel, and then you can figure out which size works for you. And then eventually you may want to go ahead and purchase some type of back support. Can you see that, Brad? I can put the camera down a little bit.
Yeah, put it down. So you're going to take a rolled towel, and because some people, depending on your size, the anatomy, you might need a smaller or a bigger one. You won't know which one to buy. But if you have you can see that towel right there. Now, for me, that feels real good. Now, if I were to buy this roll right here, it's going to be way too big. It's a larger roll. This is made for a larger person.
We should show your favorite one. Isn't your favorite one up here, Brad?
Yeah.
So he's got one that he really likes. This one right here. And I like this one in my office chair, but I don't like it in the car. You like it in the car.
Right. I don't use this one except for in the car. So it depends on what chair you're sitting in.
Right.
If you're sitting in an office chair versus at home, in your furniture, or in the car, this particular one it's made out of memory foam.
And we've got that one listed in our preferred products down below. I don't have it on Facebook yet, but I'll have it on in a couple hours.
Now, you can see when I'm in here, it just promotes good posture, leaning.
Yeah. So now he's no longer slumped. Now it's making him sit up straight.
Right.
So it's like having your mom sitting with you, going, "Sit up straight, Brad," because the cushion's doing it for you, right?
Exactly. Yeah. It's a good analogy, Bob.
So what else can we do with this seated posture? Can we do some of the stretches, Brad?
Sure. You bet. So if you are a person that sits a lot at work or at school, just doing some stretching backwards like this. So we arch the back in the opposite direction. We balance that forward slumps, what we don't want, and go the opposite direction so that spine can be stretched in the other direction, helping those discs get centralized, if we will. You could use a ball like
I would do this. I had a patient yesterday, Brad, and she actually used to work for me.
Mm-hmm.
And she's now working. She works at a computer all day long.
Yeah.
I said, You get a ball like that. She actually had a little granddaughter that has a ball, so it was no
she
problem.
took her granddaughter's ball.
She took her granddaughter's ball, but it is fantastic. She really liked it, and that alone started taking away her pain because she could put it at different levels, and you can move it, and you can use it in any chair, and you can just bend over the back of it again. So again, this is the problem, the rounding out. So the antidote is going the opposite direction, and it works out really good for that.
Oh, this is good, Bob.
All right, let's go into posture number 3, Brad.
Okay.
We're trying to keep this a little shorter today so we can take questions.
All right.
Posture number 3 is we're kind of revisiting the first one, right?
Yep. And this actually puts the most pressure on. Now, in the study, they used 44 pounds. We've only got, I think, a 16-pound kettlebell.
15 pounds. Yeah.
15 pounds.
Yeah.
But if you're lifting kettlebell, if you're lifting a load
and you're rounded out like this and forward like this, right?
And the weight's away from your body, that goes up to 450% pressure on that same
450%.
Right. So from this without a weight, put 40 pounds on, go forward, 400. If you want a recipe for blowing a disc,
yeah,
that's going to be it.
And now we can lessen this by taking it and putting it closer, can't we?
Quite a bit.
Yeah.
Actually, quite a bit. So you get it there, get your shoulders back, and hold it up in there, and there we're half of that, 220%.
So it's still a lot of stress, but not nearly as much. So we used to always joke that there's 2 times where it's hard to keep a load close to you.
Yeah.
When you have wet babies and garbage. So those you want to hold way out here.
Right.
But otherwise, you want to bring them in close as much. And that's what we always tell when you're going to lift an object. You want to get really close to it,
right,
and even straddle it,
right,
and pull it close, as opposed to low out. You know, one thing that's really bad, Brad, it can be quite often like starting a lawnmower. What are you doing? You're bending over and you're reaching way out here, and this is how much stress is that? That's probably, you know, who knows sometimes,
right? Depends on
how the cord is going,
right?
And that's why I have hurt my back pulling on a lawnmower or
and not only that, you're rotating and twisting the back, so that puts more stress.
I try to do it now with really supported and doing pulling on it because it can be very difficult.
I just have my wife do it.
Yeah, we gotta get one of the little push button ones here. So, you got anything else to say about that, Brian? Otherwise, I can start.
Well, we got some questions coming in.
I'll look. Lonnie, you got anything on your side here first? I got to look up at the. Whoops. Lonnie's not talking.
There is another thing I do want to mention that was really interesting in the study, and we've talked about it a number of times with back pain, is they studied the pressure in the disc, and when you lay down and the disc imbibes or takes fluid in, because that's how the disc survives, fluid imbibes into the disc. After 7 hours of laying flat, the disc pressure increased, 240%. So that's telling you that, and that's normal.
That's a good point.
The disc has to do that to survive. It has to get fluid in while you're sleeping, so the nutrients can allow it to grow and be healthy. But when you get up in the morning, your discs have more fluid in, so more pressure in it. So if you've got a back problem, or even if you don't get up and start bending over or lifting and doing hard work right away. You got to give your body some time after you awake out of bed.
We even make the point that when you're getting out of bed, that's where you want to get out like this. In the morning, you want to get out by rolling onto your side and then getting up like this straight, as opposed to getting up like this. Because look at my back is in that rounded out position, and your back's very vulnerable. I got 2 questions here, Brad. One's about degenerative disc disease. Mm-hmm. He's got that in the low back. He's really having a lot of trouble. And one about knee pain. They're talking about knee pain. So degenerative disc, you know, with every back problem, we try to find a movement that might help decrease some of the pain. The more you can keep your back moving, the better off you're going to be.
Sure.
And quite often, if it's true degenerative disc disease, a lot of times this exercise is one that feels good. Is going ahead and doing the single knee to chest,
sure,
and then even working to a double knee to chest and doing a little bit of pumping like this.
One thing for sure, though, as long as you're doing it, it should feel good. If it creates pain, it's not the thing. The thing about degenerative disc disease is that's one of those broad terms.
Right.
If you're older, particularly over 60, pretty much everyone's
got degenerative. So don't get focused on that. Just let's find out what you can do to get things moving. Or don't be thinking, I have degenerative disc disease. My back's not going to get better. That's not true.
I have a friend that was diagnosed with degenerative disc disease when he was just early 30s. And I still feel it's a misdiagnosis because he's in his 50s now and he's doing everything he normally does. So the disc, I think that was a misdiagnosis, actually.
But you want to go ahead and get some movement in your back.
Right.
So the other one you could do is just gentle trunk rotations like this.
Mm-hmm.
So I'm moving my knees back and forth. Again, if it's pain-free. If it hurts in one direction and it's not making the pain better, don't do it.
Right.
Do it in the other direction then. But so here's three exercises. You can do these, and then I want you to do lots of walking.
Sure.
The more walking you can do, the better it's going to be for your back. Try to get up 20 to 30 minutes a day.
Right.
And avoid the hills if you're having back pain.
Right. Usually on the flat is, walking is, as long as your back tolerates it, which typically it will, not too far, of course. And again, the hills and uneven surfaces, avoid those.
All right, knee pain. Now, if we're talking about knee pain, and again, this is a broad subject, so we're going to have to talk about knee pain as it relates to arthritis. Now, I'm assuming that with knee pain and arthritis, quite often you're lacking motion in one direction. You might be lacking motion into bending, or you might be lacking motion into extending or straightening it. With both of those, if you have either one of those, you want to try to regain the motion. And let's say it's bending. Let's say the one side, you look at one side compared to the other side, doesn't bend as far. You're going to want gently to start working on that. And you can do that in this direction too. You can start just working on bending it. Pressure on, pressure off, pressure on, pressure off. You can do those like 10 times, and you can do those every hour. I'm not saying you can do it every hour, but that's how often you're allowed to do it because you want to regain that motion. If you're lacking extension, so you're lacking straightening, what you're going to want to do is find a stool or a chair, and you're going to go ahead and you're going to put your foot up on it. If it doesn't straighten out all the way, you're going to work on straightening. Pressure on, pressure off, pressure on, pressure off. And what we have found is if you regain even a little bit of your motion back when you have knee pain, the knee pain tends to go down. So that's about the basics we give you here. We got lots of videos on it. Brad and I apologize. We just don't have the time to answer your comments. We do try to read a lot of them. But if you go to Bob, if you type in Bob and Brad in Google and then put like knee pain or knee exercises,
right, the topic
are generally or if you put it on YouTube, it'll come up.
Right.
So
I did want to mention it was Vanessa that talked about the degenerative disc disease. I'm assuming she's got another comment on that. She had surgery. She's got a pin in there and 9 screws, and her leg's having more than this. I mean, she needs to go see a physical therapist. That's way too serious to consider over the internet. So that really needs.
There's a lot of issues that we want to address with that.
Right. So,
Lonnie, you got anything?
He is just asking. He's a new grad for physical therapist.
Hey.
He's asking what is a good body mechanics with working the patients as well, like you.
Well, like a good body mechanics.
Yeah, a good body mechanics
book.
Working with patients.
Oh.
Maybe we should show them that one where you put the stick behind the.
Yeah, that's a good one. So, what the question is, Lonnie is on Facebook, and we have a new graduate. Yay!
Congratulations!
And he wants to talk about biomechanics and maybe how we teach it. I suppose,
right.
Maybe.
So, if someone is going to lift up properly, what we have this works really well. You can use a cane. We've got a piece of PVC paint right behind here. What was that, Bob?
That was my phone.
Oh, okay. And I have them, I'll tell them, touch that to your sacrum, to the mid-back, and your head, so everything is straight.
So you have 3 points of contact,
right.
Here, and here.
Yep. And I have one person right now, this is his home exercise. He holds like this. I have him bring his feet apart with good so he's got a wide base. And I have him squat 10 times like
squats.
This. So he's strengthening his legs and his hips, and he's teaching himself proper biomechanics, and it's been real successful. He had a back surgery. Actually.
You could do wall angels too. I mean, if you want to teach, trying to keep your back straight and your shoulders back,
Sure.
and again, bending like this, and then try to walk away from the wall and keep doing the same thing.
Right.
So
try to train that body.
there's a lot of different things you can use for proper mechanics, body mechanics, and they're all very important. So, Lonnie, anything else on your end?
Any braces that they can use for back and neck for posture training?
I don't know that I would use a brace for training. I'd rather have the muscles learn themselves.
Right.
There are braces out there. I mean, sometimes like you got that one back support. I don't know if that's out available here right now. You took it home with you, didn't you?
Right. Yeah, I use it.
Yeah.
I use it when I'm lifting loads.
I mean, I definitely like a lot of times we'll have people use a back support when they're going to lift, and we like the ones that tighten up, and then when they're not using it, to go ahead and loosen it up,
Right.
because you want the muscles to be working, you want your core muscles to be working, you don't want them to get weakened. But if you want a little protection just while you're lifting, yeah, I have no problem with you using a back support and just tightening up right before you lift, and then loosen it up again afterwards.
Right. That's the same approach I use. I've got someone asking about hamstring stretching with stenosis. I would suggest using the stretch out.
Oh, sure. Why don't you go ahead and show
and
Brad?
do it. You could do it on the bed. I would probably go to a carpeted floor is even better. And then with the stretch out strap, it has every 6 inches, it has a loop. And then I'm going to put one around my foot, stretch one hamstring, one leg at a time, keep the knee straight, and you can do this knee up more than likely, give more stability. Then you can put your hands through the loop here, which allows you to have more control, and you don't have to have so much grip with your fingers, if you have a problem there. And then you're just going to go up and stretch and relax. Keep the knees straight. I know Bob likes to do the contract, relax.
Yeah.
And so I'm going to push down and hold that for 5 to 10 seconds. And
So
then I'm
he's
going to
pushing down that direction.
going this way. I'm going to hold it in my hands, and I can easily resist with my hands, particularly with this strap. It really is a nice deal. And then relax. And as I'm relaxed, I'm going to go up a little bit higher, and I'm going to repeat that again. Did you do it? How many times did you do it, Bob?
Oh, I don't do it that many times.
3 times?
Yeah, probably twice.
Twice? Okay.
Yeah.
And that depends on how inflexible you are, how hard you want to work.
And you do want to stretch. I mean, you do want to make it a point of stretching these hamstrings when you got spinal stenosis.
Sure. Yeah. Get that part stretch out. So that's a good
We
question.
have a good video on that, by the way. If you haven't seen it already on spinal stenosis, and we're going to be coming out with another one very soon.
Right.
Actually, within the week.
We've
So
got 7 really good stretches.
7 good exercises. You'll want to watch that because that's really good. So, all right. Brad, any other? Or Lonnie, any other?
How do you stop electric shocks to the foot?
Electric shocks to the foot. Okay, that can be tough because that can be diabetic.
Sciatica?
Well, yeah, it could be sciatica too. I mean, if it's just electric shocks to both feet, and I mean, you have to get it. You have to figure out what's causing it first. Is it coming from your back, or is it because you have diabetes? If it's diabetes, it's going to be more of you're going to have to try to control it drug-wise, medication-wise. If it's coming from your back, then you're going to have to watch our videos on sciatica because
that's pretty complicated. There's a question about seated back exercise. Maybe they didn't see that stretch with the ball.
Yeah. Why don't you show that real quick again, Brad? So,
and by the way, I couldn't pronounce this. I didn't want to mispronounce his name, but he thanked us for going through that hamstring stretch. So,
oh, good.
Yeah, you're welcome. This is the one we really like for seated back exercise, is stretching back, and you actually get a soft ball, a firm Nerf ball or a kick ball that has a little give. You're not going to use a basketball. That would be way too aggressive. And then just lean back into it. You can use your hands on the armrest and stretch back. You can do Bob's patented hallelujah stretch, hands behind here, and then adjust the level of the ball. You may start lower and work it up 2 inches and do 3 or 4 stretches on each level. And you'll find that typically that's
very inexpensive, easy to do. I mean, there's no reason anybody can't be doing that.
Right.
Someone's asking about spondylolisthesis, Brad. Brad has spondylolisthesis, and we've done an extensive array of videos on this. And it really,
we got a nice playlist if you want to watch
yeah,
them.
it really is worth your while to go ahead and just type in Bob and Brad in YouTube and type in spondylolisthesis, and you're gonna,
if you can spell it.
if you can spell it, yeah, just start putting SPONDY and it'll come up.
Sure.
So we really wouldn't be doing it justice here otherwise. So
Yeah, it's a little bit complicated.
Lonnie, maybe we'll take one more.
Well, the question is, what's the good exercise for L4, L5 stenosis?
Okay, so the question is, what's good for L4, L5 stenosis? Again, I might defer off here. I got a video coming up. We just did it on stenosis. It's very good. It's got 7 exercises you can do. It's going to come up within a few days. Just watch our channel and watch that, and you're going to get all the answers you need.
Right, and we're actually going to take the spine out, and we go through a comprehensive. Yeah, it's one of our. It's 13 or 14-minute video, but you really should watch the whole thing. Then we have another one come up with just the 7 exercises to work with it. But for us to spend 30 seconds or a minute here,
yeah, we weren't doing justice. Right. So I know somebody also asked about drop foot. It's a big one for everybody. You know, the thing about drop foot, you want to know what it was caused by, and is there a chance you can regain some of the strength or not? Right. Like if you have it after a stroke, yes, there's still a chance that you can, other parts of the brain can help out. Mm-hmm. There might be swelling. But if it's a drop foot due to a nerve injury that is not going to recover, then it doesn't even pay to do exercise. Then it just pays to get bracing for it. Right. So
yeah, some of these things are really hard to address without the person hearing an assessment and give confident information.
Yeah. All right. Well, we want to thank everybody for watching. We'll try to go live again next week. So save up your questions for then.
All right. Thanks again. Be careful. Stay warm because it's cold here.